Jeff here with you today. Just continuing on with our talks about our modalities we have here at the Goldsby Wellness Center. Thought today we talked about the Shockwave machine here. Shockwave is a relatively new technology. It came over from England or from Europe a number of years ago. It's like a very hyper-intense ultrasound. There's two components to it. The first component is just this piece here. It's like a thumper or a vibrating unit just to go on the soft tissue, and it usually just is used to massage the unit to get the things nice and loose. The main component is this gun, and in this gun is a bullet, and the bullet comes out and hits the end and creates a tapping noise, and that creates we call a radial sound wave. The sound wave goes out much like an ultrasound, but much more intense, and goes in and breaks up the tissue and creates better tissue in its place. I find when it's on, it feels like a pinching or a burning type of sensation. We try and keep it to a pain level of 5 out of 10. Initially, when they brought the machine over, they would just anesthetize you and blast away, and they didn't think that was so good. And then they would give you a freezing, much like the dentist would, and they blast away, and they didn't think that was so good. So now it's all amount of energy we put into the tissue. So everybody's a little different. We try and keep your pain level to a 5 out of 10. We generally do 5 treatments with this, and we combine it with cold laser therapy. With cold laser therapy is in infrared light. We talked about that before. Once you break the tissue down, we try and actually recreate the tissue better with the cold laser therapy. This is really good for anything that ends in an itis. So if you have a plantar fasciitis, epicondylitis like a tennis elbow, or a calcific tendonitis, rotator cuff tendonitis, this is something we use a Shockwave for. We try and do about 5 sessions on it. After the 5 sessions, we give you a 3-week break. It will continue to get better and better and better. After that 3 weeks, we'll get you back to test it out again. Generally, you should be about 80–90% better at that point, and we won't need to do any more therapy. While you're on the Shockwave program, we encourage you not to take any anti-inflammatories such as Advil or Celebrex, or be icing the area, because that actually shuts down the inflammatory process, which is what we actually want to use to get it better. So that's the purpose of Shockwave. So anybody with a plantar fasciitis or a tennis elbow or rotator cuff tendonitis, anything like that, it's very good for. If you have any questions about Shockwave therapy or cold laser therapy or any other modalities we talked about, you can always email me at goldsby@goldsbywellness.com or talk to me on Facebook. I'm Dr. Jeff, and I've got you back.